There are many features on the temporal bone. The first I already mentioned is the ear hole. Sorry, that's not what it is. It's called the external acoustic meatus. Sometimes this is called the external auditory meatus. You also have an internal acoustic meatus, but you can't see that from this side of the skull, obviously. There are three processes on the temporal bone. Two are really easy to identify, and one is really confusing. If you touch behind your ear and move your jaw in a chewing motion, you can feel where your chewing muscles attach the mandible or lower jaw to the skull. And this is called the mastoid process. The word masticate means to chew, and this is where the word mastoid comes from. Whereas the mastoid process is rounded, the styloid process is pointy. The word stylus means writing utensil, like a pencil. Many times when human skulls are prepared for viewing, the styloid process easily breaks off. It's a thin little pointy thing. The zygomatic process is the third process and can be really hard to see on a lateral view of the skull. You don't get the idea of what it is. You really need to look at the skull from a superior or an inferior view, as you can see here on the right. The temporal bone is the orange bone in the picture on the right, and the process, which is called the zygomatic process, comes off the temporal bone and connects with your zygomatic bone, which is the cheekbone. So the process is not named for the bone from which it originates, but it's named for the bone with which it articulates or connects. Don't worry, we'll see this again. Oh, look at that. The zygomatic bone, it's your cheekbone. We saw this before because a few of the other bones we discussed that they articulate with the zygomatic bone. To get a feel where this bone really is, you have to look at the picture with it highlighted in green. We're concerned with a structure on the zygomatic bone that's called the temporal process. And it's on the zygomatic bone, and it juts out to the posterior. This is a feature it's hard to relate to in person, and it's even more difficult to recognize and explain in a virtual lab like this. I've provided a picture of the skull from an inferior angle. So this is the bottom of the skull, and you can see the hole through which the spine fits. Let's orient ourselves on this picture for a moment with two bones that we know. The occipital bone is in brown here. The temporal bones are in orange. And the new bone that we now know, the zygomatic, is in blue. Let's see how we could just see the temporal process on the zygomatic bone jutting out to the back of the skull. We can also see the zygomatic process, which is on the temporal bone and juts forward. These processes are not named for the bone that they are on. They're named for the bone that they articulate with. The temporal process is on the zygomatic bone, and it fits with the temporal bone. Zygomatic process, temporal process. Let's take a look at the two structures on the occipital bone, the brown bone, that can also be seen from this inferior view that we've been working on. The occipital bone is brown. Just want to remind you, the hole in the middle of the bone is where the spine punches through and connects to the brain. And this is called the spine hole. No, I'm sorry. It's called the magnum foramen, meaning large hole. I once had a class that they just kept calling it the spine hole. The occipital condyles are lateral to the magnum foramen. you were thinking that these can't be condyles, right? Because we know that condyles, they're like nubby ends of bones like the femur. Well, it applies here, pretty much. These are little nubs sticking out from the flatness of the bone. And these nubs sit on the atlas, which is C1, or the most superior vertebra. Atlas was the mythical man who held the weight of the world on his shoulders. The atlas bone has structures that cradle these condyles, allowing you to nod your head yes. Go ahead and nod your head yes. And as you do, these condyles rock back and forth on the atlas. We'll talk about shaking your head no when we go over vertebra. Let's enhance on the anterior of the inside of the skull. Remember that you are looking top down. This little triangle here was that new bone called the ethmoid bone, and I said to associate this with the nasal cavity. So these little holes here, they lead from your nasal cavity to the part of your brain that senses smell. You inhale through your nose, and then the particles in the air are analyzed by your brain as they diffuse through these little holes in the ethmoid bone. The holes are called the cribriform plates. You have two cribriform plates, one on each side, and the little ridge between them is called the crista galli. I don't have anything interesting to say about that structure. Let's move on to the structures here that are on the sphenoid bone. Can you see the sutures that lie between the sphenoid and the temporal bones here? They're very faint, but take a look in those deep wells. The sphenoid bone has these vague structures called wings, which are just curvatures of the bone. Here is the greater wing of the sphenoid bone. Yes, there's a lesser wing. It's not worth noting in this picture. This structure in the middle is called the sella turcica, which means Turk's saddle. Interesting. So you may not be able to get this shape from the picture, but this structure is a U shape, and it cradles the pituitary gland that kind of hangs off the bottom of the brain. Here is a medial view, and this is the view that we don't get in the classroom because models with this view are very, very expensive. The colors of the bones in this picture, they're consistent with the other pictures. The sphenoid bone is in pink, and you can see the U shape of the sella turcica. My line there, it's a little bit above the sella turcica, so you can see it. There's something cool that you can see in this picture, which are the sinuses of the skull. They were on a previous view, but I didn't point them out. Sinuses are just open spaces in the bone. When they become infected, the fluid within them puts pressure on the nearby nerves. This is the frontal sinus, and you can see the other two in the sphenoid bone. This is why when you have a sinus infection, the doctor might push on your forehead and below the eyes. Pain with this pressure would indicate a sinus infection.